the best way to treat my low thyroid? I love this because I deal with this consistently with patients and always able to get their thyroids back in a balance. Now, if it's okay with you, I just want to share with you the fact that the thyroid isn't actually the problem. What the problem is there's excess calcium in the blood. So we've got to deal with the excess calcium in the blood to be able to bring the thyroid back into balance. And this is done quite simply with a few little tweaks into what you're putting in your body in terms of herbs and things like that. So what I'm going to invite you to do is take 2 times Shilajit capsules daily for 8 weeks. Shilajit, S-H-I-L-A-J-I-T. It's an Ayurvedic herb from the bottom of the Himalayas, and it's amazing at cleaning the blood out to bring the calcium back into balance. Then I'm going to invite you to get high-grade frankincense oil, and I'm going to get you to rub it on your throat and your glands daily. I'm going to invite you to do that for 14 days in a row. Now, with thyroid issues, there's also can be some issues and dysfunction with the reproductive system because of that endocrine system connection. So I'm going to invite you to take 2 times ashwagandha capsules daily to support the reproductive system. And lastly, apologise, not last, I'm going to give you 2 more things. Next, I'm going to invite you to drink daily for 2 weeks the following juice blend. Equal amounts of all, but a little less, or 1/8 amount of the ginger. So we're going to have organic apples, organic beetroot, organic carrot, and organic ginger. Have that as a juice, equal amounts of the apple, beetroot, carrot, and just 1/8 of the ginger. And the last thing I'm going to invite you to do is look at getting some healing to deal with what has shut your power down, what has shut your voice down. So where in life did that begin? And dealing with where that happened and the trauma connected to that. Now, if you want me to support you with that, and even this whole process of moving on from the underactive thyroid, I do one-on-one intensives where people come and stay in and work with me for 5, 10, 20 days to deal with what's happening. I do rejuvenation retreats where people come along and have retreats and spend 5 days with me to deal with any dysfunction. And also I've got courses where I can support you with this, but also you can learn on a deeper understanding of the body and what's happening so you can support yourself going forward in life or even support others in your life. Anyhow, go to www.uniquecommunity.com.au, go to experiences, and all those experiences are there for you to come along to and become a part of. Or just follow the guidance I've given you right here, right now, and see that your underactive thyroid will come back to balance. And please check back in, let me know the great results you have, the great feelings you have. And until I hear from you or see you soon, please take care. Quick disclaimer, I'm not a doctor, however I have doctors that support me on the other side. So when I can see dysfunction in your body, they support me to understand what the dysfunction is and also how to treat that dysfunction. I also tap in to my studies in Ayurvedic medicine to support with understanding the dysfunction and how to treat the dysfunction. However, if you have any concerns, please don't hesitate to go and see your doctor as the first point of call.